Hello everyone. I'm going to start a series of lectures that contains important disease associations. This is for those students or clinicians who are planning to take exams such as MRCP UK, MRCP Ireland, or board exams. And my plan is to keep these videos short and give you very short and important points to remember. So let's start off with the first point that I would like you to remember and the association, and that is ejection systolic murmur is associated with aortic stenosis. Now, generally in exams, you will get a question with a stem that mostly looks similar to this one, which is you will have a patient who presents with maybe some past medical history, but this time either with shortness of breath on exertion, pre-syncope, exertional syncope, or chest pain. Now, they will give you some examination findings, which in our case usually is low volume, slow rising carotid pulse, a single second heart sound, and a mid to late peaking systolic murmur. In question, you might see an ejection systolic murmur, which essentially is the same. And the question usually is along the lines of what's your next best step in terms of investigations, or what's your most likely diagnosis. Now, what is aortic stenosis? So that is aortic stenosis, the narrowing of aortic valve that lies between the left ventricle and proximal ascending aorta. And if I were to draw and just highlight, this is our left ventricle, which if I write LV, this is our left atrium, and this is our proximal ascending aorta, and this is where the aortic valve sits. So the blood flows in this direction from left ventricle into proximal ascending aorta, and then through to the rest of circulation. Normally the gradient here, which is the area called LVOT, and the gradient here is the same because the valve itself opens and closes well. But with time, sometimes because of calcification, this valve can get narrowed down. So for the blood to flow against that resistance, you can hear a murmur, and that is ejection systolic murmur, which you will see in aortic stenosis. Now, it's important to remember that you might get questions along the lines of what's the cause? Now, in that case, you have three common causes. The most common being a calcific disease, so calcification, which is the most common cause, and that usually is seen in age more than 70, but not always. And then another cause is a congenitally abnormal valve, where you can have valve with one cusp, two cusps, or in a rare occasion, four cusps. And other conditions such as rheumatic valve disease can also cause aortic stenosis. Now, if we move on to the next slide, when does patient get symptomatic? Symptoms are uncommon until patient has severe aortic stenosis. So it's important to remember the parameters that you might get in questions, and these parameters are for patients who have a normal left ventricular function. And these includes a valve area of less than 1 centimeter square, an aortic velocity of 4 meters per second or higher, or a mean transvalvular gradient of more than 40 millimeter of mercury. Now, all these criteria must be met before a patient is labeled as someone with severe aortic stenosis. So these are some important points that I wanted to share, and the association itself being that the aortic stenosis murmur is ejection systolic murmur, i.e., crescendo, decrescendo. I hope this helps.